I'm really sorry. एक बार मैडम को भी बुलाओ ना, डॉक्टर मीरा को। राजीव साथ में ले आ। मतलब जो जैसे हम जो मीट करते हैं ऐसे केसेस के लिए कि ऐसा कैसे होता है हर पेशेंट के लिए, तो उसमें जो मुझे इंफॉर्मेशन है, क्योंकि देखो मेरा फील्ड इज़ ऑर्थोपेडिक्स, ठीक है। मैंने फर्स्ट डे आपको भी वही बोला था, और जो आए थे ऊपर मिलने मुझसे, इमरजेंसी में मिले थे प्रशांत जी, उनको भी मैंने यही समझाया था कि मैं मैनेजमेंट पॉइंट ऑफ व्यू से आपको सपोर्ट कर सकता हूँ कि किसी को कोऑर्डिनेट करवाना हो। जैसे मैडम को कॉल लग रहा था तो मैंने कॉल करके बोला, फिर 2 लड़कों को भेजा, ठीक है। मैं 2 बजे हॉस्पिटल से यहाँ से गया था, मेरी फैमिली कमिटमेंट होती है, नरवाना जाना था मुझे, मैं जस्ट निकला ही था फैमिली को लेके, तो तुरंत कॉल आ रहा था वापस, तो मैडम शायद कॉल उठा नहीं रही थी। और इन केस मैं यहाँ पे प्रेजेंट होता मान लो, क्या मैं कुछ कर पाता? My work was only to manage everything.
Yeah, no, we are not talking about you. We are talking about this as an institution, as a hospital. So I'll tell you what happened based on what we understand. I think from very early on there was misdiagnosis and there was a need to rush him off of your premise. So first of all, Dr. Meera kept saying it's pneumonia, it's pneumonia, it's pneumonia, starting from December 30th. It was not pneumonia. Fortis में pulmonologist ने they did all the testing and there were few traces in his chest and they said it's not pneumonia, it's just air bubbles if anything. So that is one thing. जब डैडी यहाँ पर एडमिट हुए उनको एंटीबायोटिक्स पर डाल दिया, very strong antibiotic which is fine, but the problem is when they did the X-ray of chest or the heart, they said heart is elongated, right? And because of that is enlarged, and because of that they did not let CPR use the pedals, electric pedal, so that they were worried they'll be shocked. That was wrong. He did not have fluid in his heart, or they could have revived him. Number 2, there was probably a viral infection. So we talked to Fortis doctors. We had a conference call with them, and they looked at all the reports, even what happened in Cygnus. There was absolutely no pneumonia. She kept treating him for pneumonia. 2 दिन 3 दिन वो यहाँ रहे, right? कोई viral infection का test नहीं किया. The worst part, last day when they came here on Sunday, उनको हॉस्पिटल से निकालने के लिए लगे हुए हैं, ओ ले जाइए लेट हो रहा है। उनका हार्ट रेट वॉज एट 50 जब उनको एम्बुलेंस में डाला गया मोहाली ले जाने के लिए, एंड उस वक्त दे शुड हैव टर्न हिम अराउंड सेइंग कि अनस्टेबल हो रहे हैं, लेट्स ब्रिंग हिम बैक। यहाँ पर किसी ने बोला कि अरे ले जाइए आपको लेट हो रहा है, जबकि बाद में हमको एम्बुलेंस वालों ने बोला कि दिस वॉज अ सिचुएशन वेयर हार्ट रेट वॉज ऑलरेडी एट 50. He should not have left the hospital in that condition, and he was forced to leave because they said le jaiye. It was not, he was not stable enough to get to Mohali, and you should have kept him in the hospital that day. And
एक बार अजय को वर्निक कॉल बुला लो दोनों को, वो at the time of incident was there, जो डॉक्टर said.
Dr. Meera was also there.
In the ambulance, they are talking about ambulance.
हाँ, डॉक्टर Rahul, Ajay, Varun.
So we took the doctor, we took the compounder in the ambulance, right? And they knew from very early on, the minute they were on, my dad was off of ventilator, he was on CPR. If he is in a hospital compound, you cannot put him on CPR and not bring him back in the ICU. उनको ICU में immediately वापस लेकर आना चाहिए था, and you should have kept him on life support. Let me tell you one thing, he did not die of cancer. His chemo was working. उनका कैंसर से डेथ नहीं हुआ है, कैंसर से डेथ नहीं हुआ है, उनका इन्फेक्शन से डेथ हुआ है, एंड देयर वाज अ हार्ट probably, because now we won't know, we didn't do autopsy, right? I wish we had done autopsy, but even with all the signs, all the blood reports we sent to Fortis, and they are clearly saying, oh, of course it was not death by cancer. Cancer ऐसे नहीं होता कि एक दिन में डेथ हो जाती है. Chemo was working. उनका 18th का भी जो blood report है, if you look at all the counts, can you open that spreadsheet?
Ma'am, what you will say about the condition of the patient at the time in emergency?
See exactly what has happened. They have called me. I don't know. I always keep the phone with me. I don't know how it went on the silent. they have called me. I accepted. I never put on silent mode. That day it has gone silent mode. And they got then somebody from management. They came and they said so I said no, I don't know.
Can you please close the door?
Just touch it.
Thank you.
And then the patient was on the ventilator. Earlier I had known the patient that he was admitted for respiratory distress.
Just close the door.
लैपटॉप बैग में
लैपटॉप बैग में
He was earlier admitted on the respiratory distress.
लैपटॉप बैग में हाँ
Bilateral chest congestion and his SpO2 was low and he was treated on antibiotic. And then I told them refer to Fortis Hospital. Then they said they are going on Tuesday, so they would like to take him home. So I told if you are taking home, you would be taking home at your own risk.
Be careful.
And then subsequently, I don't know what happened. This happened on Sunday. And when I came, the patient was on the ventilator and his oxygen was 98%. He had tachycardia. Otherwise, he had signs of pleural effusion on both the sides. And X-ray showed cardiomegaly.
Did you diagnose the patient with pneumonia at that time, ma'am? That is the
At that time,
confusion.
There, now,
At the time in the emergency or earlier.
chest was cleared up. The chest lesions were cleared. Only cardiomegaly was there and pleural effusion was there.
Okay. So
Pneumonia
okay,
analysis. Pneumonia was when he was admitted here on 14th, and even before that in December. And when I came here in January. Okay, when we came here. So first on December 30th, and then in January when I came, oh it's pneumonia, and after that my sister Sonia brought him here, oh it's pneumonia. He was admitted here for 3 days. He was here. He was put on antibiotics because the diagnosis was pneumonia, and this is all in the reports that were given to us that it's pneumonia, and it was not pneumonia. That's one issue. Other issue is it's the question of Sunday when he was brought in here. Why was he rushed off of the hospital when his heart rate was 50?
patient को refer क्यों किया था? What was the reason?
सर एक्चुअली पेशेंट आईसीयू में था और मैम से भी डिस्कस हुआ था डॉक्टर मेरा भी
Like if there was genuine emergency, क्या आप लोग को पता था कि उस टाइम पेशेंट यहाँ से हम रेफर कर रहे हैं, बीच रास्ते में सरवाइव नहीं कर सकता?
सर ऐसे तो हम कुछ नहीं कह सकते.
We couldn't anticipate that patient was hemodynamically stable except for the tachycardia. The ambulance had the ventilator and doctor was going with him, so we assumed that they would reach that place.
And did you counsel the relatives at that time?
Yeah, they were concerned.
So the heart rate was 50 when he was put in the ambulance.
मेडिकल इश्यूज तो आप लोगों को पता है, हमें थोड़ी पता है.
कौन गया था एम्बुलेंस में? तो तुमने एम्बुलेंस वापस क्यों नहीं मोड़ी जब डाउन जाता जा रहा था?
वो अटेंडेंट ने ये कहा सर को बता दिया था, वो बोले कि नहीं आगे हमें लेके जाना है. वो अटेंडेंट नहीं बना गया वापसी के लिए. अटेंडेंट ने कोई बात हुई नहीं सर अटेंडेंट से ना कुछ भी.
You guys never told the family that there is a risk of one transferring the ventilator. कि उनको ventilators निकालकर एम्बुलेंस में डाल के. Let me finish, okay? Number two, his heart rate at that time was 50. You guys, we trusted my dad to you. I came here, I talked to you, I talked to all of these people, including nursing staff, to make sure that he has the emergency support. We were not asking you to treat his cancer. We have experts for that. We were only trying to keep him alive with your help. You put him in ambulance, his heart rate dropped to 50, and you fucking did not move the ambulance around. You did not put him back in ICU on ventilator. Why not? 45 minutes CPR? They did 45 minutes CPR on him in the ambulance till they got to Ambala. 45 minutes CPR? If it is your dad, will you do 45 minutes CPR on him? He did not die from cancer. He died because of malpractice of your hospital and your staff. You not only wrongly diagnosed him with pneumonia from very early on, but that day, the day of his death, you took him off of ventilator when he should not have been. You put him in the ambulance when his heart rate was 50, not 102, not 98. And somebody rushed the ambulance off of the campus. ले जाओ देर हो रहा है. Why did not you guys put him back in the ICU on ventilator? That's the question I have. And that's the question I'm going to ask each of you in the court. Even if that means I have to take you to the Supreme Court. Do you understand that? This is a pure malpractice.
If we would have been told that there is even 1% of chance that while transferring there could be a complication, I won't have taken that step. That day, we were so scared. We were so scared. We were trying to give first aid at home, and we were trying to reach Dr. Meera. We even tried to reach you, and we were not able to. We were not able to understand even how to give first aid. Things so dramatic
We brought
that
him here because we trusted you guys, because we trusted the medical professional, we trusted, and we gave the history to all of you. We came 2 or 3 times before the emergency. We did all our homework. I was in touch with you. I was in touch with Dr. Meera. I came to emergency room. We did everything from our side. It was pure negligence, pure malpractice. He was stable in your ICU till you put him off of ventilator. You put him in that ambulance and he dipped right away.
लाइक जब अपने यहाँ पे वेंटिलेटर पे स्टेबल था तो मतलब क्या रस था हमें रेफर करने का?
फर्दर मैनेजमेंट के लिए क्या करने का था उधर? Just was clear. Cardiomegaly was there. He was due for chemotherapy. So I told, if you want, you can take. We'll refer. So we referred. It was discussed. Then they subsequently discussed with the doctor oncologist, and they came back and they said they will take the patient.
Why cardiologist was not brought to the scene? You have cardiology office right next to it, and we were told, oh, there's no cardiologist, and she did not know that there's a cardiologist on your payroll, on your staff. That is why there are hospitals, you call it multi-speciality. You should have brought cardiologists to look at him. And yes, he was due for chemo if he is alive. You can't do chemo on a dead body, which is what you ended up doing. If he is stable in ICU, the minute you take him off of ventilator and he becomes unstable, you bring him back. You don't rush him off. Who's Amit? Who was that? Amit guy? Mohit?
Mohit.
Some operator, not a doctor.
Okay.
Somebody who runs the hospital. Late ho raha hai.
I think he was his emergency in charge, and he said that late हो रहा है, फटाफट से बैठो, जल्दी जाना, and
even
the
ambulance
doctor
में नहीं रखा गया था.
Decided by the doctors, not
yeah, and even
but if
remember I asked you that when you asked that were you not told about his heart condition, and I said no. Right? Remember?
So
even
he's not going to remember anything if you ask him now. Okay? So the point is, they got into ambulance, and the doctor in ambulance, whoever there was, you were there, and he said, oh, were you not told that his heart rate at that time was 50? We are not doctors. You are. Your staff is. When we bring a patient to the hospital, we are putting that patient, our loved ones, in your care. You guys become God or Satan. You either keep them alive or you kill them. And in this case, you killed him. Cancer did not kill him. Chemo was working. Even Dr. Bedi in Fortis is shocked to hear that he's no more. Everybody in Fortis is like, oh my God, chemo was working. We were due for 3rd chemo. This may have been a viral infection, but your emergency management absolutely failed him and failed us as a family.
उनको पूरा विश्वास था यहाँ पे सिग्नस का पूरा विश्वास था मम्मी का ऑपरेशन भी यहीं हुआ है
Why did you not call a cardiologist?
कौन था ड्यूटी पे? कार्डियोलॉजिस्ट को क्यों नहीं बुलाया गया? अजय, क्यों नहीं कार्डियोलॉजिस्ट को बुलाया गया? इमरजेंसी में तुम देख रहे थे तो
Wait, she did just say that there was probably a heart mitochondria. If that is the case, your cardiologist should have been the first doctor to look at him. She just said it was a heart issue.
Not just that, it is written in the reports as well.
It's in the report.
Very pericardial effusion, it's written.
So why cardiologist was not called? Why he was rushed off the hospital into ambulance when he was unstable?
More
Do
than
you guys realize what you have done? Like उनका खून तुम लोगों के हाथों पर है. Maybe it's routine for you. Maybe तुम लोगों के लिए कोई बड़ी बात नहीं है. हर महीने एक आधा मरता है, हर महीने 2 मरते हैं, हर महीने 20 मरते हैं. हमारे लिए हमारी पूरा लाइफ डिस्टर्ब हो गया, हमारा पूरा फैमिली डिस्टर्ब हो गया. डू यू रियलाइज कि आपके काम का क्या इम्पैक्ट होता है लोगों की लाइफ में? यू गाइस आर प्लेइंग गॉड और शैतान. यू कैन कीप पीपल अलाइव और यू कैन किल देम. और अभी यू किल्ड माय डैड. You killed my dad. You all killed my dad. And I'm not going to stay quiet.
हम पांच बंदे उस एक जिंदगी से जुड़े हुए थे. उस एक जिंदगी से 5 लेडीज थी जो उस एक जिंदगी से जुड़ी हुई थी, जिसको आप सब ने मिलके हम पांचों को ऐसे राहे पे खड़ा कर दिया जहां से हमारे समझ नहीं आ रहा कि हम लोग करें तो क्या करें, जाए तो कहाँ जाए. हम 5 की लाइफ डिस्टर्ब हुई है. 5 की लाइफ.
It was pure malpractice. It was pure negligence. He was stable in ICU. You put him in ambulance. His heart rate dropped to 50. You did not bring him back. You did not put him back on ICU. You did not put him back on ventilator. Before that, completely wrong diagnosis. Completely wrong diagnosis. You kept giving him antibiotics for pneumonia. There was no pneumonia. At best, it was a viral infection. You did not test for viral infection. If you had told us, हमें नहीं मालूम क्या है, we could have taken him to Fortis 3 days before that. Not in the emergency ambulance, but we would have taken him to Fortis on 14th. Not on 18th, when he's literally dead. You put a dead body in an ambulance. Dead body. You didn't put a live patient.
That is the decision of a doctor.
Vijay, you can come
That's
here.
what we are saying. That
So our conference call with Dr. Bedi is very clear that it was absolutely shocking what you guys did or did not. Okay, it was not pneumonia. आपने गलत डायग्नोज किया, आपने गलत इमरजेंसी मैनेजमेंट किया, आपने डेड बॉडी को एम्बुलेंस में डाला. He was absolutely stable in ICU. You should have kept him in ICU. Even if you tried to transfer, his heart rate dropped to 50. You should have said, okay, he's destabilizing. We need to bring him back to ICU. And you should have put him back on ventilator. 3 दिन से antibiotic. You kept giving him antibiotic, which was wrong. It's not just one mistake, Dr. Garg. You did multiple mistakes.
And that is not mistake of mine. My field is
I'm
not...
saying hospital. You are HOD, right? I'm speaking to you as head of department.
See, I am just a coordinator between you and my department. यदि आप ऐसा बोलते कि डॉक्टर सतिंदर आपको ट्रीटमेंट करना है, I never said कि आप मतलब मेरे पास ट्रीटमेंट लीजिए. मैं कभी बोलता आपको, जब भी मेरी बात हुई मैंने आपको एक ही चीज़ बोला, I can act as a coordinator. I am not specialized doctor. The area your patient is required.
Okay, no, we understand that. So who's the primary head here?
For medical purpose, now management purpose, my name is running, but there is whole team. There is manager, there is everything. And for personal point of view, like Sammy, मतलब उनके लिए ही आपको मैंने हॉस्पिटल में की इमरजेंसी मैंने तब भी बोला था.
Right, okay.
कि
So it's
simple,
not personal. I'm not saying you as a doctor. I'm saying you as an administrator and the team here of doctors who did not do their job.
और जब हमारा इमरजेंसी के लिए भी बात हुआ था, प्रशांत जी से भी बात हुआ था, तो एट दैट टाइम मैंने बोला था जैसे सिंपल प्रोसीजर्स लाइक टैपिंग प्लूरल फ्यूजन टैपिंग, ये सब चीज़ों के लिए हम इमरजेंसी केयर अवेलेबल है. आपने कभी ऐसा बोला होता कि इन केस हमारे पेशेंट को इंट्यूबेशन, इंटेंशनिस्ट, आईसीयू बैकअप की ज़रूरत पड़ेगी, आप यदि क्लियरली हमारी कभी
We
ऐसी
did
बात
not know that. We did not know कि उनको आईसीयू की ज़रूरत पड़ेगी. अगर मुझे ये पता होता कि मेरे 3 हफ्ते के जाने के बाद I'll be coming back for his funeral, I would not have gone. हम डॉक्टर्स नहीं हैं.
और for meanwhile, if there was any confusion, somebody should talk to me regarding treatment, not
Okay, let me be very clear. Hold on. Let me be very clear here. हमने पहले आकर आप सबसे बात किया because हमें मालूम था कि टैपिंग की ज़रूरत पड़ेगी, इंजेक्शंस की ज़रूरत पड़ेगी. Those were the things we knew because Fortis told us. And वो typical है किसी भी कैंसर पेशेंट के ट्रीटमेंट में. And I talked to you, I talked to all these people here, and we prepared you for that. कोई पेशेंट ऐसे नहीं करता. We were very educated family. We prepared you with everything. We gave you the history. I brought these 2 freaking bags of reports and I showed every report to Dr. Meera. Every single report from December 29th all the way till the day I was meeting her. Okay, every single report. ये हुआ, फिर ये हुआ, फिर ये हुआ, ये symptoms, everything. Okay. This was a case of an infection which was a viral infection which this team absolutely missed. उन्होंने बोला निमोनिया है, antibiotic. They gave 4 or 5 antibiotics, which is fine, not a problem. But because they were so sure of pneumonia, they never ever tested for viral infection. They never said to us, oh हमें नहीं मालूम क्या है, तुम Fortis ले जाओ. हम ले जा सकते थे. It was not cancer treatment. It was
जब
not.
हमारे यहाँ पे पेशेंट एडमिट था तो उस टाइम क्या हमने डायग्नोज किया था मैडम?
He came with severe respiratory distress. The oxygen saturation was less than 80%.
तो at that time
At that time he was admitted, and then because that was not a condition to refer the patient anywhere. So we admitted. Luckily he responded to the antibiotics, bronchodilators, and I suggested you keep him here. And they insisted. That's why I did LAMA.
We did lama after 3 days because one thing was he wasn't improving. Second thing was
you take him directly to Fortis Hospital. I told them.
So we were here for 3 days, 2 nights, 3 days.
no blood cultures were done.
There was no blood culture done. There was no viral infection testing done. There was nothing. Basic, typical CBC, and that's it. See, the blood count, the blood report. Okay, basic stuff. Oh, it's pneumonia. And we did another chest X-ray. Your team did not even remember that we had done chest X-ray right here in Fortis. उनके 4 हफ्ते में 4 X-ray किए आप लोगों ने. Okay, you should have in your own system कि एक एक्सरे मैं करवा कर गई थी, एक एक्सरे आपने दिसंबर में किया था, एक एक्सरे आपने फिर से उस दिन किया when he was admitted. Why? Is it money making machine for you? एक्सरे करते रहो without realizing कि पेशेंट के बॉडी पर एक्सरे का क्या इम्पैक्ट है. 3 एक्सरे यहाँ पर सिग्नस में एक्सरे बोन्स ऐसे अपीयर नहीं हो जाती हैं 3 हफ्ते में. You do not do एक्सरे in like 6 months unless it's an emergency. And we had an X-ray from Fortis also. 4 हफ्ते में 4 एक्सरे चेस्ट के, 3 सिग्नस में. Okay? So he was here. If you had told us, हमें नहीं मालूम क्या है, it's not pneumonia. It's like डॉक्टर बोलता है कि oh, this is yellow curtain. We believe it's a yellow curtain.
As मतलब मैडम इज सेइंग लाइक आपने क्या रेफर कर दिया था पेशेंट को एट दैट टाइम एडमिशन के, मतलब जब 3 दिन रहे थे मैम?
No, I told them that we will refer to take from here directly to Fortis instead of going home. Then they said no, we want to take him home. He doesn't want to stay here. The patient was stable. He had responded to the treatment, and then I said, I'm going to do LAMA. You are going to take your own risk.
That time he was stable because the diagnosis was pneumonia and there was no point in staying in a hospital for 5 days. She said, oh, take him from here directly to Cygnus or to Fortis. There was no point. If you are on antibiotic and you believe that doctor ने diagnose कर दिया है, right? We took him home and he was fine for a day, 1 day. 18th को, that is when everything started going downhill.
No, I said that because if this relapses again, then it will be very difficult to treat.
But as per you, it was not that what relapsed.
There's no relapse. It was, you kept diagnosing him with pneumonia. It was not pneumonia. All your antibiotics are for pneumonia.
Pneumonia treated, responded, so patient was going to be referred. Instead, he was done LAMA. The patient was there only for 2 days with us that time.
2 nights and 3 days.
2 nights, and he did well during that time. Then subsequent step was to refer him to the specialty of care where he is taking. That was the right thing to do. Then because they refused, I did LAMA.
Sorry, I didn't get it. We did LAMA because the same antibiotics could be given at home. So that's why.
At your own risk.
Yeah, means we understand LAMA, but what we are saying is you didn't want to change any antibiotic or anything.
That was their decision to take home instead to the hospital.
Okay, that was one condition. 18th, first of all, you misdiagnosed him. It was
No,
not
it was
pneumonia.
not missed.
It
I
was
asked
not
for
pneumonia.
HRCT, you refused for HRCT because it was done 2 days ago. Because sometimes the X-ray will not show the lesion, but X-ray showed a lesion there. So I told they can allow us to do HRCT to rule out whether it's an infection or an expanded secondary lesion. They said no, 2 days ago only they have done the X-ray, so they showed me the report, and the report was handwritten. Then I said, if this is there, then there is no point doing HRCT. Anyway, he has responded to the antibiotics. I said like that.
And then the disaster on 18th. There are two big issues here. Two big issues. One is definitely the misdiagnosis of pneumonia. He was here for 2 nights and 3 days, and after that, the emergency management. Even if we had, you are saying, oh, you did not say कि ये incubation or intubation होना. First of all, we did not know. We are not the doctors. Two, अगर मैं आपसे बात नहीं भी करती, आपके emergency room में कोई patient आता है, आप उसको treat करोगे या नहीं करोगे? और बोलोगे, अरे हमें तो family ने नहीं बोला कि इनको ICU की ज़रूरत है. You won't say that, right? Exactly. So he came in. You said, oh, he's unstable. Let's put him on ICU. Okay? 2 hours he was on ICU. He was stabilized. He was fine. And if you suspected that there's a heart issue or there's anything like that, even if you misdiagnosed the previous pneumonia, you should have not put him in the ambulance.
One thing जो मुझे सुनने में आया था, मैं एक चीज़ बताता हूँ आपको. किसी भी डॉक्टर को, मतलब एक पर्सनल पॉइंट ऑफ व्यू से बोल रहा हूँ, मतलब किसी पेशेंट को नुकसान पहुँचा के कुछ एक्स्ट्रा क्या बेनिफिट होगा, आप एक बार अपनी आत्मा से, अपनी सोल से पूछिए. क्या इसमें मतलब किसी ने ऐसा कुछ हो कि कोई हैवी मतलब पेमेंट इशू हो? मुझे पता है ये एक फैमिलियल की तरह हो गए थे हम लोग की, लाइक आप मैसेज पे बात हो रही है, प्रशांत जी से बात हो रही है. द मेन कंसर्न वॉज हेयर. जो हमारे डॉक्टर्स थे, जो टीम थी, वो घबरा गए थे. सीधी सी बात है. क्यों घबराए थे? मेरे पास कॉल भी किया था कि कोई लेडी हैं जिन्होंने बहुत ज़्यादा हंगामा कर दिया है कि मतलब
क्योंकि यहाँ पे डॉक्टर नहीं थे, आधा पौना घंटा तक वेट कर रहे हैं, डॉक्टर नहीं है, इमरजेंसी में डाले हुए हैं, नो डॉक्टर वाज अवेलेबल. मैंने हंगामा किया, बहुत
बोला
किया.
था डॉक्टर अजय इज हियर, डॉक्टर विक्रम इज हियर, एवरीवन वाज देयर एंड उन्होंने पेशेंट स्टेबलाइज कर दिया था. बट यहाँ पे जो मैंने सुना, बहुत ज़्यादा ऐसे हुआ, अटेंडेंट्स काफ़ी दूसरे पेशेंट्स भी इकट्ठे हो गए थे. तो इट वाज लाइक कि मतलब हम क्या करें, इतना मतलब हाई प्रोफाइल पेशेंट है, कुछ हो गया दिक्कत हो जाएगी. तो पेशेंट को स्टेबलाइज करने को इमरजेंसी से भी रेफ़र किया जा सकता था पेशेंट. बट द पेशेंट वाज इनिशियली टेकन टू ICU, पेशेंट वाज स्टेबलाइज्ड एंड देन ही वाज रेफर्ड. इट वाज ड्यू टू, यदि कोई भी शांति से मैच्योरली एक बार, क्योंकि आप देखिए, मान लो कोई डॉक्टर नहीं था, आप जैसे बोल रहे हैं कोई डॉक्टर नहीं था, इमरजेंसी में डॉक्टर था, ICU में डॉक्टर था, क्या पेशेंट वेंटिलेटर पे अपने आप चला गया? मैं
सर,
दे आर इंटेंशनलिस्ट, दे आर डूइंग दिस जॉब सिंस
Okay, let's be very clear. ये आत्मा, soul, I understand. Nobody is saying कि किसी ने जानबूझ के उनको मारा है. We are not saying that. That's not the point.
If I wanted to refer, I would have referred without admitting the patient, because when the patient first time he came with a chest symptom. He was taken X-ray, then HRCT showed metastasis in the liver, and immediately I referred the patient. See, if I wanted that patient, when they came for the OPD with the chest discomfort, not able to breathe, I would have referred the same day. We are not good, but still we admitted and we treated for the possibility of whatever it is. He responded to the treatment.
Question is not कि intentions क्या है. Intentions matter नहीं करती हैं, actions matter करते हैं, right? तुम दिमाग में कुछ भी सोचते रहो, उसका कुछ फर्क नहीं पड़ता. What you do with your hands is where the results come. Okay?
And plus,
so that's one thing. And then number 2 is घबरा गया. Your staff.
It's not like घबरा गया.
No,
It's like
I know, I
chaos
understand.
in the
High
hospital.
profile. Right. The point is that's part of the medical training. Part of the medical training is your focus is only patient. Only patient कि तुमको मेडिकल स्कूल से इतना किसने प्रैक्टिस करवाया है. सो व्हेन यू आर इन अ क्राइसिस सिचुएशन, यू कैन कीप योर कूल, यू कैन कीप योर calm, and you can actually treat the patient the way he or she should be treated. Not कि फैमिली ने हंगामा किया. फैमिली तो हंगामा करेगी. That's their job. Family is doing their job. You do your job.
प्लस जो हंगामा हुआ वो तब तक हुआ जब तक डॉक्टर्स अवेलेबल नहीं थे. एज सुन एज डॉक्टर्स वर अवेलेबल, वी वर quite calm. Not even after doctors were available. The upstairs girl, I forgot her name. The doctor who manages on the first floor, the girl,
Dr. Kiran.
Dr. Kiran, I guess. So when she explained, we were quite calm. After that, we stayed calm, and she explained ventilator process and everything, and we had already put him on ventilator. She explained we will keep him overnight, and after overnight, we will try to remove the ventilator 10% by 10%, reduce the ventilator 10% by 10%, and then eventually remove the ventilator. We were quite fine with that. And after that, Dr. Meera came in, so we spoke to Dr. Meera that, hey, this happened, and she even said that, oh, unka phone silent per tha, and that's why she didn't respond for last 2 hours. We said, okay, that's fine, let's move on. So anyhow, then she did X-ray, and she said that she's seeing the cardio thing, enlargement of her heart, and she thinks there is a fluid in there, and she suggested to take him to Fortis Hospital. But even that time, she didn't explain what could be the chances of transferring him from ventilator to ambulance ventilator. And then we were like, okay, we will take him to Fortis. So we spoke to dad, means not speak, but we did explain to dad that, hey dad, this is what happened, we are taking you to Fortis. I explicitly asked Dr. Meera that, hey, could there be any issue in taking him to ambulance? And she said, no, there would be ventilator in the ambulance, there won't be any issues, you should be able to take him because he's stable. And since he was stable, so I counted on her words. And after that, she also said there is no cardio here, and that's why we have to transfer
It's
him.
one thing after another.
No,
You
I
had
did
a
not take the
cardiologist.
name of the cardiologist. I did not take the name. I said there could be a possibility of the effusion. So
नहीं
patient
आपने
was
ये
stable.
बात बोली थी, आपने ये बात बोली थी कि भी यहाँ पे कार्डियोलॉजिस्ट नहीं है,
नहीं
So-
है, cardiologist
आपने
है।
बोली थी ये बात.
Anyhow, so we didn't know that why, means to be true, we were and then I left that, okay, dad is being transferred to the ambulance, so I left the room, and then I was waiting outside ambulance, and suddenly I'm seeing the doctor and his attendant, they are like standing, and there are all medicines everywhere, and they are giving injections, and I thought that, oh, probably they are like setting him up, and we waited down the ambulance, and then I think it was Dr. Mohit, whoever is that person, he pushed, he was like, hey, get into the ambulance fast, and we were like, oh, why, what happened? And then he was like, get into the ambulance, we need to rush. And I was like, okay. We were quite, मतलब हमारा दिमाग उस वक्त काम नहीं कर रहा था, हमें कुछ भी समझ नहीं आ रहा था, बिकॉज हमें 1 घंटे के अंदर ये सब कुछ हो गया था, 2 घंटे के अंदर ये लगा लो. और we sat, and then it started driving, and suddenly we are told that he's been given CPR for a long time and he's not responding. And it was
And not only that, there's one more thing. Wrong, again, another wrong diagnosis, कि heart में liquid है, they will not use the pedals on CPR. Not only you literally put a man with 50 heart rate into the ambulance, you did not even give him electric shock to revive him, because again misdiagnosis that there's liquid in his heart. The enlargement of heart was not because of the liquid, it was because of what had happened because of the infection and the cardiomyopathy. Okay, mistake after mistake after mistake after mistake, and the end result, my dad is not here today. Okay, it's like from very early on, very first day when he got sick in December, he was brought here. We put our trust in your team. And again, not you as an individual doctor, we put our trust into this team, and you all failed us miserably. You all failed us. December x-rays. After that, I came here. My husband came here. We brought him when there was an emergency. 2 nights he was here. We brought him the last day when there was an emergency. If he is high profile case, you don't rush him off of the hospital. You take care of him with the utmost careness.
यदि पेशेंट स्टेबल नहीं था, वाई शॉक क्यों नहीं दिया?
सर एक्चुअली क्या होता है कि पेशेंट को डीसी शॉक तब देते हैं जब पेशेंट को जैसे कोई वीटी आ रहा है या वीएफ चल रहा है. अगर पेशेंट ब्रैडीकार्डिया के अंदर है ना, तो कोई इंडिकेशन नहीं है पेशेंट को शॉक देने की. पेशेंट की अगर हार्ट रेट कम है ना, तो हम उसको एट्रोपिन वगैरह लगा के ट्रीटमेंट देके हम उसको पेशेंट की हार्ट रेट को बढ़ा सकते हैं.
But
जो कि
atropine
डॉक्टर
did
आपने
not
किया.
work. Atropine did not work. When atropine does not work, if you have to choose between a dead body and giving paddles, why didn't you give the shot?
मैम अगर पेशेंट की अगर हार्ट रेट बिल्कुल फ्लैट हो जाती है, अगर पेशेंट को बिल्कुल फ्लैट होता है तो उस पेशेंट को कभी भी उसको शॉक नहीं देते हैं।
तो पहले क्यों नहीं किया बिफोर इट वेंट फ्लैट?
क्योंकि मेन चीज़ एक्चुअली क्या था कि मैं एक बार, क्योंकि जो ये पेशेंट की बता रहा हूँ मैं आपको बात, पेशेंट के पहली बार 3 एक्सरे जब हुए, पहला एक्सरे तब हुआ जब पेशेंट फर्स्ट डे यहाँ पर एडमिट हुआ, सेकंड एक्सरे जो पेशेंट का हुआ जब पेशेंट वेंटिलेटर पे गया, सेकंड एक्सरे तब हुआ। अब वेंटिलेटर पे जाएगा तो हमें उस चीज़ के लिए कंफर्म करना है। जब पेशेंट इमरजेंसी के आया, क्रिटिकल सिचुएशन थी, इंट्यूबेशन बिना कंसेंट के कभी भी नहीं होता। इंट्यूबेशन बकायदा कंसेंट लेके
I agree, intubation मेरा consent से
हो गया,
नहीं,
आगे
आपकी
बढ़िए।
सारी बात डिटेल में बता रहा हूँ।
हाँ ठीक है, बताइए।
तो इंट्यूबेट बिना कंसेंट के नहीं होता है।
हाँ, ठीक है।
इंट्यूबेट करके पेशेंट को स्टेबल करने के लिए आईसीयू में शिफ्ट किया गया।
Yes.
ठीक है, जब तक मैम नहीं आए। जैसे ही मीरा मैम ने देखा, पेशेंट की कंडीशन को देख लिया कि उस टाइम पे जो पेशेंट, जिस टाइम पे मैम ने देखा पेशेंट को, जैसे कि सारी चीज़ें हो गई, जैसे मेटास्टेसिस है, कार्सिनोमा वगैरह है, रेस्पिरेटरी इशू हो गया। जब पेशेंट वेंटिलेटर पे चला गया तो रेस्पिरेटरी इशू भी साथ में इंक्लूड हो गया पेशेंट को। तो पेशेंट वेंटिलेटर पे गया, तो इसलिए मैम ने सारी कंडीशन को देखते हुए कि पेशेंट को हमें शिफ्ट कराना चाहिए। ठीक है, तो और दूसरी बात कि कोई भी ऐसा नहीं है कि अगर वहाँ पर इनको जैसे कि शोक अकॉर्डिंग टू सिचुएशन देना है हमें पेशेंट को, अगर जब नीड है। और कोई भी ऐसी चीज़ नहीं है कि हाई रिस्क हमने वहाँ पर एक्सप्लेन हमें नहीं किया, हमने सारी चीज़ों को हमने एक्सप्लेन कर रखा है उस चीज़ का। ठीक है,
कहाँ पर एक्सप्लेन?
और दूसरी बात, उस दिन एक्चुअली क्या था, संडे था। संडे के दिन हमारी जो ओपीडीज होती हैं वो क्लोज होती हैं। दूसरा, जब इमरजेंसी आई, इमरजेंसी देखने के लिए स्पेशल मैम को बुलाया गया। मैम आए देखने के लिए, ऐसा नहीं कि मैम देखने के लिए नहीं है। हो सकता है कि किसी कारण से, देखो मैम, किसी इमरजेंसी के कारण मैम का फोन इधर उधर हो, जब आप बता रहे हो
आप मिसिंग द पॉइंट, आगे चलिए, वो तो हो गया कहानी।
उसके बाद हमने
हाँ।
पेशेंट को एम्बुलेंस में शिफ्ट कराया।
हाँ, at that time his heart rate was 50.
मैम ये बता रहा हूँ आपको, पेशेंट जब वेंटिलेटर के ऊपर है, वेंटिलेटर एम्बुलेंस में अवेलेबल था, जो कि हमारे आईसीयू में अवेलेबल था। सेम वेंटिलेटर वैसा एम्बुलेंस के अंदर भी हमारे वेंटिलेटर अवेलेबल था। जो डॉक्टर ने हमारे आईसीयू में देखना था, जो डॉक्टर हमारे आईसीयूज को देख रहे हैं, आईसीयू के डॉक्टर हमारे डॉक्टर हल साथ में आपको अवेलेबल हुए। साथ में एक नर्सिंग स्टाफ भी अवेलेबल कराया गया इस चीज़ के लिए। जितनी भी क्रिटिकल केयर की मेडिसिन थी, सारी मेडिसिन इनको अवेलेबल कराई गई। पेशेंट को सडन कार्डियक अरेस्ट होना, जैसे पेशेंट ब्रेडिकार्डिया में है, तो ब्रेडिकार्डिया में पेशेंट को हम शॉक नहीं दे सकते। और जिस हिसाब से जो मेडिसिन की रिक्वायरमेंट थी, अब जब यहाँ से पेशेंट गया, यहाँ से जब पेशेंट एम्बुलेंस में चला, तो पेशेंट यहाँ से जब चला तो 5 to 10 मिनट्स तक पेशेंट को कुछ नहीं था। 10 मिनट्स के बाद
that's
No, no,
not
no,
true.
no, no, no,
His
no,
heart
no.
rate was 50 when he was in ambulance. 50, right?
50, क्योंकि मैम कई पेशेंट ब्रेडिकार्डिया में रहते हैं, उनकी
50 is not bradycardia. Below 50 is
बिलो
bradycardia.
पेशेंट की हार्ट रेट जो 50 है, 50 में
Why didn't you turn around? Why didn't you bring him back into ICU?
मैम जो 50 हार्ट रेट है, हमारी फर्स्ट प्रायोरिटी क्या रहती है कि हमारा पेशेंट जब सीखा है और हमने पेशेंट को हमने जितनी जल्दी पहुंचाना है, हमने वहाँ पे पेशेंट को शिफ्ट करना है। जो फैसिलिटीज़ हमारे आईसीयू के अंदर अवेलेबल थी, हमने सारी फैसिलिटीज़ उसमें दी, डॉक्टर दिया, कार्डियक मेडिसिन दी, सारा कुछ अवेलेबल कराया। वेंटिलेटर में पेशेंट था, कोई ऐसी चीज़ नहीं, हर चीज़ काउंसल दी। और जो जैसे 50 हार्ट रेट पे हम पेशेंट को लेके जा सकते हैं। जैसे ही उनको अरेस्ट आना स्टार्ट हुआ, उसी टाइम डॉक्टर राहुल ने अपने सारे क्रिटिकल का जो भी मेडिसिन लगानी थी सारी लगाई हैं मैम। ऐसा नहीं कि कोई उन्होंने अपने तरफ
वो
से medicine
immediately you guys started CPR as soon as he got into ambulance. उनका ICU से एम्बुलेंस तक पहुंचने में हार्ट रेट ड्रॉप हुआ। ओके, ऐसा नहीं कि वो ICU में 55 हैं, यहाँ तक 50 हो गया, कोई बात नहीं, चलेगा। He was perfectly fine here. He was stable. His vitals were what they should be. 5 मिनट में ICU से एम्बुलेंस जाने में when heart rate dropped to 50, why didn't you turn him around and put him back into ICU? Why didn't you do that?
निकलते सीपीआर चालू कर दिया हमने, निकलते
वो बात ठीक है आपकी, लेकिन
You had to start CPR on him right the moment he got into ambulance.
जब पेशेंट की जब हार्ट रेट सर 50 थी ना एम्बुलेंस के अंदर, उस टाइम पे भी जो कार्डियक मेडिसिन थी ना सर, उस टाइम शुरू करी थी। ठीक है, यही था कि हमें पेशेंट को जितना जल्दी हम करें, क्योंकि जो ट्रीटमेंट हमने यहाँ पर इनको देना था आईसीयू के अंदर, वही सारा ट्रीटमेंट उसमें करा था कि हम पेशेंट को वापसी।
No, there was a difference. There is a difference because ICU में he was stable, right? He was perfectly fine. He was stable. He was responding everything, and then you took him.
After 10 minutes.
10 मिनट्स के बाद सीपीआर शुरू हुआ मैम। जब पेशेंट आईसीयू से, जब वेंटिलेटर वाली एम्बुलेंस निकल चुकी थी, पेशेंट को 5 to 10 मिनट्स हुए थे, उसके बाद पेशेंट को कार्डियक अरेस्ट
No,
हुआ।
5 to 10 नहीं हुए थे। उनका हार्ट रेट उसका 50 था when he got
हार्ट
into
रेट 50 इज नॉट द मैटर मैम। कार्डियोलॉजिस्ट इज अवेलेबल, आप उनसे बात कर सकते हैं कि 50 हार्ट रेट पे क्या हम पेशेंट को यहाँ से ट्रांसफर कभी नहीं करते हैं, ट्रांसफर होते हैं मैम। ऐसा नहीं
होते
है।
हैं,
हमारी
अगर-
फर्स्ट प्रायोरिटी ये थी कि पेशेंट को हम सेफली वहां पर पहुंचा दें कि जितना बेटर से
अरे
बेटर
you should have
ट्रीटमेंट
thought कि एटलीस्ट 3 घंटे का रास्ता है यहाँ से मोहाली का. How will he survive if he's starting at heart rate of 50?
Plus, it was depreciating. It was not like,
It's
oh, he
not
was
like,
always 50
राजीव
and then
को
you
बोला
move at
दूसरे रूम में
50.
ओपीडी देख लेगा, ऊपर से डॉक्टर को बुला लेगा।
It was not like he was, oh, he was always 50, 55 and
Yeah.
now he's 50, so it's fine.
It dipped significantly. It's a decline, right, like that.
Just
In that case, you turn around and you put him back on ICU. And you did not do that. In fact, you kept rushing him off of your campus so that you don't have to declare him dead and you don't have any liability. You could have saved him. He may be alive today.
he was declared dead in Ambala. Ambala is like 1 hour away and 45 minutes CPR was done.
It's our effort, 45 minutes effort.
No, that's okay. That's okay. I'm not saying.
CPR procedure is of 30 minutes. Either Dr. Rahul do his job best, very best.
See,
45 minutes से CPR कंटिन्यू उन्होंने किया किस लिए कि हमारा पेशेंट रिवाइव हो जाए किसी भी तरीके से।
Yes, I agree.
ठीक है?
I agree.
उन्होंने अपने पूरे एफर्ट्स लगाए
I'm not even
वही
complaining
efforts
about
अगर
him.
वही एफर्ट्स अगर इन केस देखो मैं तो एज ए आपसे फैमिलियर बात कर रहा हूँ, मैं एज ए प्रोफेशनल नहीं बात कर रहा हूँ आपसे एज ए फैमिली मेंबर कि देखो हम मेरा घर का पेशेंट भी होता है ना, हमारे को ये होता है कि जब हमारे को डॉक्टर ने रेफर कर दिया कि हमें कोशिश करनी है कि पॉजिटिविटी के साथ चलना है हमने कि पेशेंट को पॉजिटिविटी के साथ हम किसी
नहीं,
तरीके से
पहली बात
पहुंचा
तो
दें।
एक मिनट, पहली बात तो ये है कि ये सिचुएशन आने ही क्यों दी।
Why didn't you turn
कि
around?
PCR देना पड़े।
If he was declining so much, why didn't you turn around the ambulance and bring him back into the ICU instead of going to Ambala? If you know you started CPR, you are only, even if we say 10 minutes. Before that, पहले आपने ये बोला था कि immediately, आपको नहीं मालूम था heart rate was 50, immediately pretty much CPR start हो गया था. Okay, even if it was 5 minutes. 5 मिनट प्लस 5 मिनट वापस टर्न अराउंड 10 मिनट में he would have been on ICU, he would have been okay. Instead of going 45 minutes and you doing CPR for 45 minutes. Who does CPR for 45 minutes? Nobody. That's wrong. I understand कि आप फैमिली के लिए यहाँ बचाने की कोशिश कर रहे थे and you were continuing 45 minutes. That I understand. But the problem is, why did you not turn around? You did not have to put him in ambulance. Even if you did put him in the ambulance and it went down significantly, turn around, put him in ICU, save him. You don't keep him in ambulance for CPR. It's not like कहीं गांव में है कि हॉस्पिटल नहीं है. अगर मेरे घर से निकल रहे हैं, okay? मेरे घर से निकल रहे हैं गांव में जहाँ पर बिजली और पानी तक नहीं है, then I will do CPR for 45 minutes and I'll keep going because मेरे पास कोई ऑप्शन नहीं है. तुम सिग्नस से टर्न अराउंड क्यों नहीं किया?
यहाँ जो पेशेंट बैठे हैं ना उधर दिखवा दो।
सिग्नस को क्यों नहीं बोला कि अरे हमारे पास मल्टी स्पेशलिटी हॉस्पिटल है, हम 5 मिनट निकले हैं, CPR शुरू हो गया है, इट्स नॉट वर्किंग, लेट्स ब्रिंग बैक. हम अम्बाला नहीं पहुंचेंगे, लेट हिम स्टेबलाइज, कीप हिम फॉर अ डे 2 3 व्हाटएवर. वी कुड हैव पुश्ड द कीमो. कैंसर से नहीं मरे हैं वो, आप लोगों की नेग्लिजेंस से मरे हैं. ICU में वापस आना चाहिए था उनको. He was not ready to be in the ambulance. You cannot do CPR for 45 minutes on a patient who's declining. He was stable. He was stable, and from stable patient to heart rate of 50, ऐसा नहीं है कि यहाँ पर 60 है और वहाँ पर 50 हो रहा है. Then you can say, हाँ 50 में हम transport करते हैं. We get that. If your heart rate is at 110 or 108 or 105, then he goes to 50 in a split second like that or in couple of minutes. You don't keep going. आप मुड़कर वापस आओगे कि यार लेट्स पुट हिम बैक इन ICU. You know, we had really high hopes from this hospital. Really high hopes from this.
He had
Staff.
really high hopes. And more than anything, why we didn't call a cardiologist over there in the
When you
emergency?
have a cardiologist on your staff.
Refer the case, so we didn't expect a cardiologist to come here because patient in that condition, what procedure he could have done, pericardial effusion, aspirate तो नहीं कर सकते. We were referring.
These are all medical lingos. You can't throw these terms at us because we don't know. We are not the expert.
But cardio-
Okay. The point is, cardio is a heart doctor. His heart was going down. You should have brought him.
Cardiomyopathy is a medical term. Myocardial, all medical terms.
These terms we learned after.
We had to go research. When we talk to doctors, it's like, okay, did this happen? Did this happen? Did this happen? Misdiagnosed, leading to very, very extremely bad emergency management. Very bad. It's completely malpractice. It's completely negligence. आपके intentions क्या हैं वो मैटर नहीं करते हैं. आप अपने परिवार के लिए क्या करोगे मैटर नहीं करते हैं. In some ways, your medical profession आप अपनी परिवार के लिए मे भी वो नहीं करोगे. You have more responsibility towards a patient.
एक्चुअली क्या होता है कि अगर मेरे पास जो पेशेंट आता है ना, तो ये पेशेंट की जो कंडीशन होती है ना, वो हॉस्पिटल वाले ही ज़्यादा जानते हैं. अगर मेरे पास कोई और भी आएगा ना, तो मैं किसी और को यही कहूँगा कि ये पेशेंट अगर मेरे पास होता ना, तो मैं इस पेशेंट को इस तरीके से ट्रीट करता. ये ट्रीटमेंट इसमें इस चीज़ में ये ऐड होना चाहिए था. ऐसा नहीं है. हमारी तरफ से हमने कोई एफर्ट्स कहीं पर भी नहीं छोड़े हैं. जो कि हम जो कर सकते थे, वेंटिलेटर पे लगा सकते थे, वेंटिलेटर पे पेशेंट लगा हुआ, कैथेटराइज हुआ पेशेंट को एंटीबायोटिक ना लगाना, ये कहीं भी नहीं लिखा हुआ ये चीज़. हमें पेशेंट को प्रोटेक्ट तो करना है ना किसी चीज़ के लिए हमें. ठीक है, पेशेंट जब हमें पता है इन्फेक्शन का सोर्स ईटी, इन्फेक्शन का सोर्स कैथेटर, इन्फेक्शन का सोर्स, और पेशेंट को ऐसी कंडीशन में देखना विद कंसेंट इंट्यूबेट करना ज़रूरी था. पेशेंट को स्टेबलाइज करना ज़रूरी था. पेशेंट को हमें प्रॉपर जगह पे पहुंचाना वो भी ज़रूरी था. अब पेशेंट अगर डिटेरियोरेट कर रहा है, अगर हमने ऐसा होता है ना कि अगर पेशेंट को हमने एम्बुलेंस से अपने आईसीयू तक हमने शिफ्ट करना है, पेशेंट को जब हम एम्बुलेंस से सीपीआर करते हुए शिफ्ट कराएंगे, ट्रीटमेंट क्या रहेगा वही रहेगा, आईसीयू का डॉक्टर सेम रहेगा, सारा कुछ सेम रहेगा. तब उस टाइम पे हमने यही बेटर समझा कि जो बेस्ट हम ट्रीटमेंट चल रहे हैं कि हम कोशिश करें कि एम्बुलेंस को रन करो, फटाफट से कोशिश करो कि हम हायर सेंटर पे पहुंच पाएं. क्या पता कुछ एक्स्ट्रा हो जाए और पेशेंट हमारा रिवाइव हो जाए. और पेशेंट मतलब
इफ यू स्टार्ट सीपीआर 5 मिनट एम्बुलेंस में डालने के बाद आपको कैसे लगता है कि वो 3 घंटे का ट्रैवल कर पाएंगे?
पूछो मैम. एक्चुअली क्या होता है, कई बार सीपीआर अगर हम दे रहे हैं ना, तो 5 मिनट में पेशेंट रिवाइव करता है, 10 मिनट्स में रिवाइव कर जाता है. ऐसा नहीं
जब वो 10 मिनट में नहीं रिवाइव किए, व्हाई डिडंट यू टर्न अराउंड?
After 20 minutes. After 20 minutes.
Why didn't you turn around? You did not have to keep driving for 45 minutes to get to Ambala. 3 different hospitals में गए हैं ये लोग अम्बाला में. 3 hospitals में.
एम्बुलेंस में कि आगे लेके चलो, पेशेंट को वापस नहीं
रिवाइव नहीं हो रहे.
रिवाइव नहीं हो रहे.
तो उन्होंने कहा सर आपसे रिक्वेस्ट है हमारी,
रिक्वेस्ट है आप लेके चलिए आगे, मूव ऑन करिए.
मैं साथ थी.
तो यही बात थी ना कि भाई आप रिक्वेस्ट है आपसे थोड़ा कि आप आगे लेके चलिए.
No. They said
नहीं पहुंच पाएंगे. मैंने कहा मैडम को.
हाँ, इन्होंने बोला रिवाइव नहीं हो रहा है, वी वांट टू स्टॉप. इन्होंने
हम नहीं पहुंच सकते क्योंकि बहुत लंबा हो जाएगा.
Exactly. You don't start CPR और 3 घंटे का कि 3 घंटे की जर्नी वो भी
And that's why we had to
जब भी
stop in
सड़कें बंद हैं.
Ambala.
I was not able to do a video call with them because there was no Wi-Fi. सड़कें बंद है, riots हो रहे हैं, everything. There was all these political conditions also that were happening that would have, you should have used your brains. You should have brought him back into ICU here.
And all they said was कि हम Fortis नहीं ले जा पाएंगे, हम, and he's not reviving, and our understanding was he want to stop CPR, and then we requested no, please keep doing CPR.
Because then you have no choice. You keep doing CPR.
क्या होता है कि कई बार ना हम छोटी सी बात का ना मिसअंडरस्टैंड कर जाते हैं उस बात पे, क्योंकि डॉक्टर के लिए उस टाइम पे क्या होता है कि सीपीआर करना बहुत जरूरी है. उसी टाइम कन्वर्सेशन भी करना, साथ साथ पेशेंट को रिवाइव भी करना, सीपीआर के साथ साथ मेडिसिन बताना कि ये लगाओ, और साथ साथ मॉनिटर को देखना. 3 minutes देयर इज अवेलेबल. मॉनिटर भी देखना है,
That's why you get paid, right?
मेडिसिन भी करना है.
That's why you are trained and you get paid.
ये सारा किया, लेकिन उस टाइम पे अगर एक कॉल इनका भी होता ना कि बैक ले चले आप सिग्नस में.
How can they tell? They're not doctors. They're not medical professionals.
ये बात अगर हम नॉर्मली बात कर रहा हूँ मैं कि अगर आप उस टाइम पे अगर एक बार डॉक्टर को कॉल करते कि डॉक्टर साहब सिग्नस में वापसी ले लो, अगर पेशेंट को रिवाइव नहीं हो रहा तो आप वापसी लीजिए.
हमने उस बारे में सोचा ही नहीं. हम यदि वो हमें बोलते तो हम सोचते, उन्होंने बोला नहीं.
वो उनका काम है, हमारा नहीं.
See, the patient was in the ward, pneumonia, respiratory.
ऐसा है मैडम, कुछ मर्जी कर लो इस आर्गुमेंट को, आप जितना मर्जी लंबा खींच लो. नेग्लिजेंसी आप लोगों से हुई है, ये आप लोग एक्सेप्ट कर लो. बस सीधी सी बात ये है. आप मानो कि भी आपकी गलती की वजह से आप लोगों ने मेरे डैडी को मारा है.
I told them we'll shift the patient to ICU. For that they refused. But with the ward only, patient became all right. That when he was admitted for the second time, I told them if he's not responding like this, we will have to shift to ICU.
She was not just saying that they will shift to ICU. She was also saying that they will do lung bypass. But
no. I told you we shift to ICU. that the daddy doesn't want to go to ICU. Then I said we will refer the patient to Fortis. You take the patient to Fortis.
वो तो पहले ही आईसीयू में थे, वो क्या मना करते हैं?
She's saying
Happened it
on
before. So this is what the decisions are not solely left to the doctor. They also took the decisions. I have a OPD. Can I? This is. Thank you.
ये अपना पल्ला झाड़ा और साफ हो गए।
No, पल्ला ऐसे थोड़ी झड़ जाएगा. So the bottom line is, we are not medical professionals. That's why we come to hospital. That's why we pay hefty amount to doctors to take care of patients. It's your staff's call to say, hey, he's not reviving, turn him around and take him back and put him on ICU, put him on ventilator, take him home. Take him back to Cygnus. You don't keep driving for 45 minutes and keep doing CPR for 45 minutes. That's bloody insane.
And how am I expected to take a decision when I'm not even a medical professional? I'm
It's one
just
thing to
told-
take consent. उसमें भी अब 25 पेज का वो fine print होगा. I'm pretty sure. Do you really expect people to read all the fine print that you have in anything? Still, we gave that. We are not even questioning कि ventilator पर क्यों डाला. Okay, so don't keep bringing that up. We gave the consent to put him on a ventilator, and you did. But then you did not tell us that his heart rate has dipped from 100 something down to 50 in 5 minutes when you're transporting him from ICU to ambulance. And that's high risk. That's immediate decline. You bring him back. You don't even start the ambulance. You bring him back. You put him in the ICU. You don't start CPR and try to go to Fortis, which is 3 hours away without any road closure.
बड़े 10 मिनट पहले ही कहा उन्होंने डिक्लेयर करना है, तो उनको बस रिस्पॉन्ड नहीं करना पेशेंट में। बड़े 10-15 मिनट पहले ही कहा उन्होंने, पहले तो कुछ बोला ही नहीं है। 35 मिनट से कर रहे हैं हम।
यहाँ बैठ जाओ, बैठ जाओ।
So this is what happened. This is the care my dad got from your team. In spite of all my best efforts, in spite of we are coming from US, one person is here, first I am, then my husband, then my sister, so that we are educated family, we can guide, we can work with your team.
तुम लोग तो जाओ तो ठीक है।
थैंक यू
सी इनिशियली ऋतु जी जब हमारी फर्स्ट टाइम बात हुई थी, फर्स्ट टाइम तो आपने मुझसे पूछा था कि मेडिसिन के डॉक्टर कैसे हैं। यू आस्क्ड मी, आई हेजिटेटली सेड कि आप इमरजेंसी शाम में भी करा सकते हैं मेडिसिन के लिए। आई सेड, फिर आपने बोला कि डॉक्टर मीरा इज ऑल्सो फ्रॉम बेंगलोर, यू कैन टॉक टू हिम। सो एज हॉस्पिटल एडमिनिस्ट्रेशन, लाइक एट माई पोजिशन, जस्ट फील इट एंड से, like I was thinking your family and every person is coordinating well with Dr. Meera. Okay, even when the patient was admitted here, मुझे नहीं पता था कि पेशेंट एडमिशन है 2-3 दिन। उस टाइम हमारी यही बात चल रही थी कि नर्सिंग स्टाफ होम केयर के। मुझे नहीं पता था कि आपका पेशेंट यहाँ पे है, वरना मैं ज़रूर एक बार तुमसे मिल के आता ऊपर। हर पेशेंट जो भी होता है या कोई मतलब मुझे कोई आपसे भी इन्फॉर्म में बात हुई हो। 3-4 दिन बाद जब हुआ कि ऐसे बैजनाथ जी आए थे, उनका फिर हमने वो कर दिया था रेफ़र। मैं बोला कि रेफ़र क्यों किया था, कोई कन्फ्यूज़न था, क्या था, कैसे हुआ था? तो बोले कि नहीं, फिर वो ट्रीटमेंट नहीं हो पा रहा था, हमने लामा कर दिया था पेशेंट को। तो उसके बाद आई डोंट नो, मतलब मैंने फॉलो भी नहीं किया। और सडनली इमरजेंसी में, और उस दिन दिक्कत वाला काम क्या है कि मैं सुबह 6 o'clock से 2 o'clock तक संडे को यहाँ पे था, ठीक है। और जैसे ही मैं निकला यहाँ से तुरंत कॉल आ रहा था, वरना मेरी इंटेंशन कभी ऐसी नहीं होती एज ए मेडिकल सुपरिटेंडेंट कि मैं वापस नहीं आऊँ, ठीक है। वापस आके भी मैं या हॉस्पिटल को डिसीजन नहीं लेने होते। डिसीजन किसके होते हैं? डॉक्टर के।
But she is on your
मेरी
staff.
knowledge
She is on
of-
your payroll. She is Cygnus employee.
आई नो, बट मैं आज भी आपको एक चीज़ बोलता हूँ, हेजिटेटली मैंने तब भी बोला था आपको, आपने बोला था कि मैं कोऑर्डिनेट कर रही हूँ, सी इज गुड। मैं ऐसा नहीं है कि अपने डॉक्टर के लिए कुछ बोल रहा हूँ,
No,
but
she's not good. She's bloody useless.
but like
She's filthy piece of shit. That is what she is. She came from diagnostics. We didn't even know that. वो diagnostics से आई हैं और हम बाद में ये सोच रहे हैं कि कोई बैंगलोर छोड़कर क्यों कैथल गांव में आके प्रैक्टिस करेगा, बिकॉज इसको कहीं जॉब नहीं मिल रहा है. Okay? So
She's not a good
I'm not
doctor.
talking about you as a person or you as a medical professional. I'm talking to you as a head of department. I'm talking to you as a Cygnus representative, because let's be very clear, we are going to file a lawsuit against Cygnus, against her. Okay? So she's definitely not only going to lose her job, we are going to put a lawsuit against Cygnus. तो मैं आपसे Cygnus के representative की तरह is talking to you. Okay? Not you as a person. I mean, I always appreciated that, you know, I initially reached out, we connected. So we were always very grateful for everything that we were putting in place for our dad. If she is so bloody disqualified, उनको सिर्फ एक्सरे रीड करना आता है, now she's making call on किसी की life or death पर, she's so bad, she should be fired, her medical license should be revoked. She should not be allowed to practice medicine. Because tomorrow she's going to kill someone else.
ये तो ऐसा लग रहा है जैसे कोई नालायक बच्चा मेडिकल ले लेता है ना, पॉइंटों में पास होके अपना डिग्री लेके बस ऐसे ही
हम तो डॉक्टर्स को चेक नहीं करते हैं ना, हम तो हॉस्पिटल को चेक करते हैं कि मल्टी स्पेशलिटी, इट्स अ प्राइवेट हॉस्पिटल एंड वी फाउंड सम कनेक्शंस, लाइक ओके वी हैव अ टीम इन प्लेस, दे कैन टेक केयर ऑफ माय डैड. वी ट्रस्ट द डॉक्टर्स हायर्ड बाय अ हॉस्पिटल.
And I don't understand.
डॉक्टर को देखा कुछ नहीं आता है, डॉक्टर गए दिनों साल में तो कुछ नॉलेज लगती नहीं इनको, कुछ भी मेरे को, मैंने पहले भी देखा है इनको, मेरे को कोई नॉलेज लगती नहीं जो डॉक्टर गए थे.
Any of these doctors were not qualified.
And more than anything, I still don't understand why she didn't call the cardio. She said that she saw in X-ray and whatever she saw, and then she said that heart has been enlarged and possibilities there is a fluid in the heart. Why she didn't call the cardio?
And you know, that afternoon what my dad had at home, so it started with a viral infection and she kept treating him for pneumonia. It was not pneumonia. Even December में उसने बोला pneumonia है. We went to Fortis. I talked to the doctors there and doctor said no, it's not pneumonia, it's wrong. And even when he was in hospital here, I kept talking to her like, what is the diagnosis? Get to the bottom of diagnosis. क्यों उनको cough हो रहा है? क्यों उनको breathlessness हो रही है? It was a viral infection. It could have been treated with very simple viral infection management.
And not just that, I told Dr. Meera even that time, please talk to Dr. Bedi. Please talk to Dr. Bedi, because I am not understanding the medical things, and Dr. Bedi is his primary doctor. But she didn't call Dr. Bedi until the day we were leaving. The only call was when I coordinated. When I coordinated on 14th, and Dr. Bedi and Meera talked, and he said we should do ECG and EKG just to make sure it's not the heart, and ECG EKG was done that day. And after
3 दिन उन्होंने ECG EKG भी नहीं किया when he was in the hospital. It's blunder after blunder after blunder. It's not just एक और दो mistake. एक के बाद दिसंबर से लेके अब तक सिर्फ मिस्टेक्स हुए हैं. निमोनिया, फोर्टिस ने बोला this is not pneumonia. Then they came here again. She did not say. She kept saying pneumonia. अगर ये बोल देती कि मुझे नहीं मालूम क्या है, we would have taken him to Fortis very early on. उनका viral infection का टेस्ट हो सकता था. डॉक्टर बेदी ने बाद में, I talked to him like 2 days ago, conference with his team. Okay, and they said it was probably just a viral infection, which could have been easily treated. They kept giving him medicines for pneumonia, which was not the case. अगर हमें ये बोल देते हमें नहीं मालूम क्या है, तो हम ले जाते ना, हम ले जाते. अब बोल दो कि हमारी औकात से बाहर है ये मैनेजमेंट, हम ले जाते. Why did you keep him here? Pneumonia का, and then final emergency management. That was a complete disaster. तुम किसी पेशेंट को अगर वो 100 की हार्ट रेट से you are down to 50 within few minutes, you don't trust for them. You bring them back. You say okay, unstable हो रहे हैं, let's bring him back. Put him in the ICU. क्या बकवास है कि वो फैमिली से पूछा, अटेंडेंट से पूछा. What is that bullshit? अभी तो हम पढ़े लिखे हैं. आपके गांव से कोई उठकर आएगा जिनको एक वर्ड इंग्लिश और हिंदी का भी नहीं बोलना आता, वो क्या तुम्हारे लिए डिसाइड करेंगे यार?
It's not about family decision or any decision.
Right.
It's the decision
जिसका जो
of a
काम है
doctor.
उसे वही पता होगा ना.
अल्टीमेटली
और
Responsibility.
यदि वो शायद हमें बोलते कि हमें वापस ले जाना है, हम बोलते हैं या फाइन,
Of course.
यू आर द डॉक्टर्स, यू मेक अ डिसीजन.
You tell us कि क्या करना है. You don't send your kid to school and teacher को बोले मुझे आज मैथ पढ़ा दो, मुझे आज रीडिंग पढ़ा दो, मुझे आज अलजेब्रा पढ़ा दो.
Now they are saying that this is the case of miscommunication, that oh डॉक्टर का मतलब था कि हम वापस ले जाएंगे और आपने वो इनविजिबल मीनिंग समझा नहीं, हिडन मीनिंग समझा नहीं.
इवन 10 किलोमीटर पहले कहा जी, बोले बट डिक्लेयर करना है इनको, बस रिपोर्ट नहीं कर रहे, ये बात नहीं, पहले कुछ बोले ही नहीं है, सीपीआर कर रहे हैं 35 मिनट से.
You don't do CPR for 45 minutes, doctor. It's that simple.
I even requested, मतलब मैं लिटरली हाथ जोड़ रही थी वहाँ डॉक्टर के सामने कि प्लीज उनको एक बार इलेक्ट्रिक शॉक देकर देखो, कुछ होगा. They were like, oh, after 45 minutes of CPR we cannot give electric shock. That's
तो
what
पहले
they
देना
said.
चाहिए था ना. अगर तुमको ये भी लग, मतलब मिस्टेक आफ्टर मिस्टेक आफ्टर मिस्टेक. एक तो टर्न अराउंड नहीं किया, पहले तो एम्बुलेंस में जाना ही नहीं चाहिए था. दूसरा टर्न अराउंड नहीं किया जब तुम्हें लगा कि CPR नहीं काम रहा है. तीसरा, why do you get to the flat line? You bloody idiot. CPR का मतलब ही वो है कि you don't get to flat line. हमने भी इतने टीवी शो देखे हैं कि हमको मालूम है फ्लैट लाइन का क्या मतलब है. It's common sense. You don't do electric shock is part of CPR process, not oh मेरा पंप नहीं काम कर रहा है हाथ से, so now he is dead, now I'm going to try electric shock. इतने idiot हैं क्या? What kind of staff this is? Not only Dr. Meera is a disaster, it seems like ये भी किसी को CPR तक basic CPR नहीं करना आता है. Even I know CPR. Even I know CPR.
They were doing CPR by hand, and why they didn't do electric? And think that we are over there, completely blank mind. All we are seeing is something is going on screen. We are not even understanding that heartbeat is natural or it's because of the CPR that is being given. We are not understanding. All I'm seeing is irregular rhythm, and that's pretty much it. And मुझे समझ नहीं आ रहा कि क्या हो रहा है. Seriously, I was that blank.
And we didn't, I mean, no
कुछ
family
भी
is going
समझ
to
नहीं आ रहा है.
interfere. They're like, oh, उनको करने दो जो कर रहे हैं. You
Yeah.
don't want to interfere. You're
That-
not going to ask questions.
That's what happened. That's when I got into ambulance and they were doing, we stayed quiet, complete quiet, because we were like, oh, whatever they are doing, they are
उनको करने दो जो कर
करने
रहे
दो.
हैं.
Like I don't want to interfere and then lose their minutes or seconds for on
belief
this.
was on a doctor. He is gonna take decision.
Exactly.
I understand this point, but
Exactly.
And I don't understand until now, like why they didn't call the cardio. क्योंकि मुझे बोला गया we don't have cardio over
my
here, and I was like,
position, at my position, I feel extremely sorry. Only this word I can say, and at my behalf, I can only ensure that आप लोग के साथ हुआ, शायद कुछ और लोगों के साथ ऐसा मैं ना होने दूं आगे फ्यूचर में.
शायद
मतलब आई एम
शायद।
सी मेरी बात सुनिए. देखिए मैं एक पोस्ट मिली है मुझे यहाँ पे, ठीक है. आई एम जस्ट डूइंग माई जॉब, आई एम डूइंग मैनेजमेंट. मैं क्या है कि इनकी जगह दूसरे ट्रेनिंग डॉक्टर चेंज ऑलरेडी प्रोसेस में है. डॉक्टर पवन आएंगे और पूरी टीम चेंज करूँगा. बट वो कैसे
That
आएंगे?
doesn't fix our situation.
मैंने इसलिए बोला ना आपको कि एट माई पोजिशन मैं आपको बस इतना कर सकता हूँ. ज़्यादा से ज़्यादा आई नो दिस लाइक एरिया इन कैथर, ठीक है. आई स्टडीड इन एम्स इंस्टीट्यूट. आई गॉट फर्स्ट रैंक इन ऑल ओवर इंडिया. आई एम डूइंग ऑर्थोपेडिक्स ओनली. बट ड्यू टू जितने जो पेशेंट्स आ रहे हैं, जैसे आप भी अप्रोच किए, वो एट द बिहाफ ऑफ किसी ने आपको मेरा नाम सजेस्ट किया होगा, किसने बोला होगा. तो इट्स नॉट अबाउट हॉस्पिटल, इट्स अबाउट
Right.
माई फेस वैल्यू जो ये हैपन हुआ है. तो मतलब बट इस चीज़ में मतलब ये हैपन हुआ है, ये हुआ है. मैं क्या है कि टीम चेंज करूँगा, ये करूँगा. बट जो मतलब मैं आपको कैसे समझाऊं कि मतलब जो चीज़ गई है मैं उसको मतलब नहीं ला सकता. मैं ओनली मेरे बिहाफ पे आपके सामने ऐसे कर सकता हूँ अपनी टीम की तरफ से. मैं देखिए मेरे खुद के रियल ताऊजी कोरोना में यहीं पे एक्सपायर किए हैं.
दैट्स द अदर मैटर.
ठीक है, मैं ये नहीं बोल रहा कि वो है ये है. मैं ये फील कर सकता हूँ कि अपनों को खोने का क्या
आप शायद वो चीज फील नहीं कर पा रहे जो हम फील कर पा रहे हैं।
देखिए मैं भी एक तरह आपके साथ ह्यूमन हूँ और देखो
Sir, my dad was supposed to live. He was responding to chemo. You should see his blood counts. You should see he responded to every time medicine. The only thing that failed was this.
इवन कि उनकी विल पावर थी,
We did
वो विल
sleep.
पावर उनकी ऐसी थी, उनकी
No.
इम्यूनिटी भी स्ट्रॉन्ग थी, विल पावर भी थी,
The dedication-
जो इतनी बड़ी
We did
बीमारी से
sleep.
वो लड़ रहे थे।
टुवर्ड्स योर पेशेंट आई वाज टोटली लाइक, और जब मुझे इसका वो हुआ था ना, मैंने ये बोला था इनको कि फर्स्ट टाइम तो जैसे आप लोग का जो कंसर्न है ना कि यदि तुमने 10 मिनट्स बाद सीपीआर चालू कर दिया था तो इसमें क्या जाता, तो लाइक आप इस चीज को चाहे गलत समझे, उनका ये था सर हमें डर लग रहा था। यू आर राइट कि एज ए मेडिकल प्रोफेशन
यहाँ तो हल्ला उतारने वाले जो रिलेटिव्स होंगे वो हल्ला उतारेंगे ही,
नहीं,
जिनका
जस्ट
बंदा
अ
होगा
मिनट,
अंदर।
जस्ट अ मिनट। और हल्ला भी हमने इसलिए नहीं उतारा था कि हमें आपके किसी उस पर वो था, हमें नहीं इसलिए उतारा था क्योंकि यहाँ पर डॉक्टर अवेलेबल
नहीं
नहीं
आ रही
थे।
थी।
और ऐसा भी नहीं था कि हमने कोई मेजर हल्ला किया या कुछ किया, हमने जस्ट ये हल्ला किया कि डॉक्टर को बुलाए।
यू आर राइट एट योर प्लेस
एंड इट वाज डन एन आवर बिफोर, इट वाज नॉट डन लाइक ओ उस
क्या
वक्त
बोल
कोई
रहे हैं
हल्ला
कि
हो
आप
रहा
तो
है।
मैडम नहीं आएंगी, वो तो जा चुकी है, हमें ये वर्डिंग बोली है, क्यों नहीं आएंगी? इमरजेंसी मतलब क्या होता है? इमरजेंसी का मतलब क्या होता है कि भी कोई भी कहीं भी अगर वो डॉक्टर नहीं आएंगे तो कोई आएगी थी।
It's not OPD.
इमरजेंसी सिचुएशन एंड
इमरजेंसी में तो अगर आप खाना भी खा रहे हो ना तो वो भी छोड़ के आपको आना पड़ेगा। अगर आप रास्ते में हो तो वहां से भी आपको वापस आना पड़ेगा, चाहे आपका कितना
सर
जरूरी
हम
काम क्यों ना
उन्हें
हो।
लगातार कॉल कर रहे हैं, मैं घर पर हूँ, आई एम ट्राइंग टू गिव हिम फर्स्ट एड,
हमने
I'm trying to
घर
give him
से-
first aid at home, and I'm calling Dr. Meera. Dr. Meera, what is something that I can do to save my dad? And
घर
she's
से
not
हमने
picking
फोन
up the
कर
damn
दिया
call.
था। मतलब हमें घर से यहाँ तक एम्बुलेंस पहुंची है, उसमें डाला, उसमें भी 15 मिनट लगे हैं। घर से हमने कॉल किया है, 15 मिनट वो और पौना घंटा यहाँ का, 1 घंटा वो, और 1 घंटे बाद मैडम आ रही है तो 1.5 घंटे बाद और आके कहते हैं 5 मिनट बाद ओ इनको ट्रांसफर ले जाओ, इनको रेफर कर रहे हैं हम। किस लिए रेफर कर रहे हो? आपकी ड्यूटी क्या है?
Even if it was a cardio, she should have called a cardio specialist. Why she didn't call a cardio
2.5
specialist? Why she didn't tell me that there is a risk factor? Why she didn't tell me the heart rate has dropped? Should we keep him? If she wanted a consent, these consent should be taken, not just consent that hey, can you sign the paper? Yes, I did sign the paper, but
कंसेंट इसलिए लिया जाता है कि भी अगर मान लो कोई रिस्क होता है तो उसके लिए आप जिम्मेवार हैं। इसके लिए नहीं कि भी अगर आप नेग्लिजेंसी करोगे उसके लिए भी हम जिम्मेवार हैं।
इमरजेंसी सिचुएशन एज ए मेडिकल देयर इज नो नीड ऑफ कंसेंट। इवन
Exactly.
बोल भी देते हैं कि हमें इंट्यूबेट नहीं करवाना,
तभी
तो
तुम्हारी
जॉब है।
ड्यूटी ऑफ ए डॉक्टर टू
Yeah.
इंट्यूबेट द
Right.
पेशेंट एंड सेव द लाइफ।
I
Yeah.
was surprised that there was a consent
क्योंकि कंसेंट
needed.
इसलिए लिया क्योंकि पहले ट्रीटमेंट जो किया था वो गलत किया था
नहीं,
डॉक्टर मीरा ने, जो उन्होंने एंटीबायोटिक
Consent
दिया
कौन
है।
करता है? ICU में कंसेंट लेंगे आप? Oh, somebody is dying. Oh, कंसेंट चाहिए
Consent
CPR करने के लिए, because रिस्क फैक्टर तो हर चीज में है ना डॉक्टर।
मतलब उन्होंने बोला
अगर
कि
तुम हर चीज के लिए कंसेंट करोगे तो तुम में और मेरे में कोई फर्क नहीं है।
उन्होंने बोला कि तुम कंसेंट करोगे तो, एंड आई एम लाइक ऑफ कोर्स आई नीड टू सेव माय डैड। एंड फिर उसके
And
बाद
don't, it's a shitty, bloody fucking shitty excuse to say phone silent पर था। What are you, चौकीदार हो क्या किसी जेल की? You're bloody a doctor. How can your phone be on silent?
और कह रहे कि
So
फर्स्ट टाइम हुआ,
we
हमें क्या
lost
मालूम?
our dad because her bloody phone was on silent. Her phone was on silent.
And not just that, after she comes in, okay, even Dr. Meera would have been there. They said that the only thing she would have done is to put him on a ventilator, which is fine. We had already done that. But even after she came, based on her own diagnosis, why she didn't call her cardio doctor? Why we were told that there is no cardio doctor?
My heart,
Whatever cardio
that
problem is there.
Okay, why didn't she call cardio? You are not cardio. You are primary care. अगर तुमको लगता है कि कुछ हार्ट का प्रॉब्लम है, of course she knows it's a heart का
अगर
प्रॉब्लम।
उसके बाद वो करते, अगर उसके बाद वो रेफर करते तब समझ में आता।
She literally said कि तुम उनको फोर्टिस ले जाओ, वहां पर कार्डियो भी होगा, तुम्हारे oncologist भी हैं, it would be better.
So
And-
she knew it's a heart issue.
And-
Why didn't she call cardiologist? That is what I'm saying, Dr. Garg. It's
we
not
were
one mistake.
we were ready to stay overnight when Dr. whatever Kirti Karika whatever her name is, when she explained that they will keep on pipes for on bypass for overnight and slowly by slowly they will remove. We understood that and we were like, yes, we understand.
We were here for 2 nights before that.
We
were
understand.
fine to keep him here and spend the money.
After she said that she
About like money was not a concern at any point of time.
No, I know it was not, but the negligence is ridiculous.
It was the quality of treatment that was not.
I was told there is no cardio. Now she is refusing that, but she said that there is
इसने
no
भी मुझे बोला
cardio.
कि भी कार्डियो नहीं है. मुझे लगा कि भी यहाँ पे जो पहले कार्डियोलॉजिस्ट थे वो चले गए हैं.
तो हमारे पास है इन केस रिक्वायरमेंट.
बल्कि मैं भी सबको ये कह रही हूँ कि भी यहाँ पे कोई कार्डियोलॉजिस्ट ही नहीं है. इवन के मेरे पास एडवोकेट्स हैं, आई एम आल्सो ए लॉयर, तो मेरे पास एडवोकेट्स आए, वो कहते जी क्या हुआ, मैं क्या ऐसे ऐसे हुआ, डॉक्टर मीरा ने की नेग्लिजेंस, मैं क्लियरली बोल रही हूँ, सही बता रही हूँ, मैंने बोला डॉक्टर मीरा ने गलत ट्रीटमेंट किया, उनकी नेग्लिजेंसी की वजह से, उनके यहाँ पे कोई कार्डियोलॉजिस्ट भी नहीं है, तो इस वजह से मेरे फादर की डेथ हुई है, डेथ हुई है, और ये भी कह रहे हैं उन्होंने उनको मारा है.
इनफैक्ट मैंने ये कहा कि यदि हमें डॉक्टर मीरा बोलती कि देयर इज अ रिस्क फैक्टर इन ट्रांसफरिंग, आई वुड हैव गॉट अ कार्डियो फ्रॉम अनदर हॉस्पिटल, फ्रॉम अनदर इंस्टीट्यूट. I could get a cardio from
It's that
another
simple,
institute
doctor. He should
over
not-
here instead of.
और
He
इवन
should
के
not
आप भी बुला सकते हो किसी भी कार्डियोलॉजिस्ट को दूसरे
We
उससे.
have in
हम ले
all-
आते.
We have
Yeah,
one
but-
cardio doctor 24
तो हमें
hours.
क्या मालूम, जब हमें बोला कि भी है ही नहीं.
He should not have been put in the ambulance. He should not have been.
The patient was stable.
He should have been in the ICU here. We were ready to keep him overnight, 2 nights, 3 nights, whatever was needed. उससे पहले वो लामा क्यों किया? That was another bullshit. Okay? 3 दिन यहाँ पर थे. She came twice. ऐसे ही राउंड लगाकर क्या कर रहे हैं? एंटीबायोटिक चल रही है. तो एंटीबायोटिक तो हम घर में भी दे सकते हैं. What is the point of keeping him in a ward in Cygnus जब तुम कुछ कर ही नहीं रहे हो?
एक कमरे को पूरा डैडी के हिसाब से उनकी जो नहीं जरूरत है, जो हॉस्पिटल में मिलता है, पूरा हॉस्पिटल वाला बेड वहाँ पर है, घर पे है,
ऑक्सीजन
सिलेंडर वहाँ पर है हमारे पास, मतलब हर मेडिकल
We have
फैसिलिटी
a
हमने
compounder.
घर में वो की हुई है. और हमारे पास कंपाउंडर भी था, अगर यहाँ से आ गया वहाँ से भी, वहाँ से आ जाए वहाँ से भी, मतलब हम कोई रिस्क नहीं लेके चल रहे थे कि किसी भी एक पॉइंट पे, किसी भी एक जगह ये आ जाए कि भाई हम कहीं पे भी हम अपने फादर के लिए कुछ भी करने को तैयार थे, और सब चीज हमने घर में की हुई थी.
And I don't know the very first night when she said, oh, so my dad was still breathless after taking her medication, and I was like, doctor, he's still breathless, and we asked the on-call in the night doctors that can we ask Dr. Meera that hey, what's happening? And her response was, oh, यदि आप चाहो तो उसको उनको better hospital में ले जाओ.
Who said this?
Dr. Meera.
उसको उसमें प्रॉब्लम हो गया. And then
और
my
फिर
dad kept telling her, नहीं बेटा कुछ नहीं बोलो, नहीं बेटा कुछ नहीं बोलो, हमको निकाल कर फेंक देंगे. That is what he was worried about. Can you imagine that? Like is
यदि
that
वो निकाल कर फेंक देते ना तो शायद बेटर होता, क्योंकि हम लोग अनदर डॉक्टर के पास लेकर जाते.
But that's the image you give, that's the confidence you give to your patient कि वो डर रहे हैं तुमसे बात करने के लिए भी. They can't even
And
ask you.
all I was asking was, he's still breathless, and she said, oh, we can move him to ICU and we can do bypass of lungs, and I was like, what do you mean by bypass of lungs?
उसको कुछ नहीं मालूम है. All she has done is probably read a textbook and she came here to practice.
Means
I did not realize कि ये इसको सिर्फ diagnostics का experience है.
even I didn't know that. On the third day, I was like, man, I have lost all the trust in Dr. Meera. I have to get out.
मैं तो आप मेरी
That was
friend
my
है,
call.
उनके हस्बैंड का ट्रीटमेंट यहाँ से चल रहा है. मैंने कहा मत करवाना, पता नहीं क्या कर देगी.
No, but seriously, like on the third day also, the reason
मैंने
I was still talking to my dad, probably हम यही रहते हैं. I was talking to my family कि probably हम यही रहते हैं, it would be better. But Dr. Meera had said कि वो यहाँ से जाएंगे तो उनको ये खांसी का प्रॉब्लम नहीं होगा, उनका ब्रेथलेसनेस नहीं जा रहा था. फिर उसके बाद जब डॉक्टर मीरा से थर्ड डे बात हुआ, we realized she even read the wrong report. She was supposed to read the report of pulmonologist, लेकिन we didn't have that report, and she read the report of 3 months before, and that's when I realized, oh, she probably is messed up. And
She
I
has
was
no
like,
idea. वो रिपोर्ट भी नहीं पढ़ती है.
हाँ.
यहाँ पर 4 एक्सरे 4 वीक में you did 4 एक्सरेज on
and
his
she's
chest.
doing HR scan when we had given all the reports to her with the HR scan.
And now she's saying वो HR scan नहीं करने दिया. 2 दिन पहले HR scan, are you bloody idiot?
ऐसे पेशेंट में तो repeatedly ऐसे नहीं कर सकते.
You don't do HR scan every day. You don't do X-ray every week.
The very first day I came, they took all the reports, including the Fortis reports. And they did take every damn report from me.
कुछ नहीं पढ़ा, कुछ नहीं पढ़ा. Everything we did Excel sheets. We prepared a delta. ये blood report का है. ये ऐसे ये decline हुआ, ये increase हुआ, ये decrease हुआ. एक चीज का count. We are feeding information to her. लेकिन देखो ये हो रहा है, ये हो रहा है, ये हो रहा है. हम पढ़ रहे हैं, हम समझ रहे हैं हर रिपोर्ट को because she doesn't have time. वो कुछ effort नहीं डालती है रिपोर्ट में. CT scan हो रहा है, X-ray हो रहा है, कुछ नहीं पढ़ा है. Fortis के pulmonologist का रिपोर्ट नहीं पढ़ा इसने. He clearly said लंग का कोई इशू नहीं है, कोई निमोनिया नहीं है, कोई टीबी नहीं है. उन्होंने म्यूकस कल्चर किया, पूरा टेस्ट किया. She didn't read any of that report and then kept saying pneumonia, pneumonia, pneumonia. It was not fucking pneumonia. Tell her that.
I kept asking her, talk to Dr. Bedi in all those 3 days. And even when on the third day I asked, did you talk to Dr. Bedi? She was like, oh yeah, I'm going to talk to him. All the 3 days she kept, I'm going to. What is I'm going to? He's his primary doctor. You should get a consult with him. We came here because he wanted ECG, EKG to be done and get onto a call with a doctor who can do.
ECG, EKG हो जाता, we would have learned a little bit more. अगर ये हमें बोलती कि निमोनिया नहीं है और हमें नहीं मालूम क्या है, हम फोर्टिस ले जाते. अगर ये एम्बुलेंस में नहीं डालती, he would still be alive. अगर ये एम्बुलेंस को टर्न अराउंड कर देते, he would still be alive. There are so many others, Dr. Garg here. So many mistakes were made. It's not one, it's not two. It's over and over mistakes. When you have a high profile patient because you have educated family who has done their homework, you do more precautions. You don't do less. घबरा गए थे, that's stupid.
That was what they said, but
Right.
I told कि this is not the case कि मतलब हम
घबरा
अपने
गए थे.
पेरेंट्स को लेके जा रहे हैं कहीं पे, उनका तो हम घबरा जाएंगे तो क्या ट्रीटमेंट नहीं करेंगे. ट्रीटमेंट इज मेडिकल प्रैक्टिशनर होता है, उसकी सबसे पहली ट्रेनिंग यही होती है कि घबराना तो होता है.
Exactly.
और कम से कम कार्डियो डॉक्टर को तो बुलाओ प्रेमिसेस पर. Ask him to look into the case. उन्होंने सिंपल एक्सरे किया है. She didn't even do ECG EKG on that day. एटलीस्ट वो ECG EKG देखती तो शायद हमारे पास बेटर इन्फॉर्मेशन होती, वेदर इट इज फ्लूइड, वेदर इट्स enlarged, or whether it's some organ failure or what the hell. But she didn't even do that. Of course, I'm not a doctor, and when I spoke to other doctors, they said, oh, did she did ECG EKG so that I can read the report and tell what happened. Right now, we don't even know what happened to my dad. All we know is that he's no more. That's it. He didn't get a fair fight with cancer. He was improving.
सबसे बड़ी जीना मरना तो भगवान के हाथ में है, लेकिन अगर डॉक्टर सही नहीं होंगे,
नहीं, जीना मरना भगवान के हाथ में सिर्फ तब है जब
डॉक्टर्स के हाथ में है.
अगर सही से वो नहीं ट्रीट करेंगे तो उसका क्या फायदा.
She should have told me risk factors. I asked her 3 times that day. There won't be any problem in transferring. There won't be any problem. And she was like, no, आप ले जाइए. No, आप ले जाइए. She was sitting in a corner. मैंने बोला डैड को हार्ट में पेन हो रहा है. डैड said उनको यहाँ पर दर्द है. I went to her and I said she gave muscle relaxer. मैंने बोला muscle relaxer का कोई प्रॉब्लम तो नहीं होगा. She was like, no, it is just a muscle relaxer.
I don't think she knows how to practice medicine. उसने सिर्फ किताब पढ़ के डॉक्टर का ठप्पा लगाकर शी इज प्रैक्टिसिंग हियर ऑन पीपल जिनको गिनी पिग बना लिया है. शी शुड बी फायर्ड ऑन द स्पॉट. शी शुड नॉट सी नेक्स्ट पेशेंट.
Will be. Actually, we took her in our team after seeing she has expert CV. In the CV she has worked a lot, but मतलब हमने खुद तो कभी नहीं देखते ना किसी पर्सन को. जैसे आपने तो कभी ट्रीटमेंट लिया नहीं डॉक्टर के पास से, तो you were believing on her profile.
We were believing on her being in Cygnus doctor. We didn't even check her profile. वो उसने खुद मुझे बोला because I came in here after you and I first talked. I met Dr. Ajay, I met Dr. Meera, and I said this is the history. I showed her all the reports, and then we started talking about Bangalore because my husband is from Bangalore, and I asked her. I said, what brought you to Cathal? ये तो गांव है, तुम यहाँ क्या कर रही हो? Right? And she gave me something like, oh, I lost my job and I didn't find anything. And I'm like, that's a red flag. कि तुमको कहीं जॉब नहीं मिला तो तुम कैथल में आ गई. But I still, and she said she herself is a cancer survivor.
Yeah, that's what moved us.
So
when
that
she
is what
said
made
that
us feel like, okay, उसने खुद कैंसर पेशेंट है, मेडिकल का डिग्री तो है ही है, so थोड़ा बहुत कुछ पता होगा. What we did not know, उसको बेसिक इंटरनल मेडिसिन नहीं मालूम है.
and I don't मतलब I cannot believe today. अब तक तो मुझे ये था कि यहाँ पर कार्डियो डॉक्टर नहीं है. अब right now I cannot even believe why.
You had a cardiologist in stuff. Why didn't she bloody bitch call the cardiologist? Why?
And now it's on me that I killed my father because I didn't ask her why the hell you are not calling a cardiologist or why I'm not arranging a cardiologist. Do you think how difficult it is on me that every day I'm going through what decision could I make, where could I put my foot down and what could I do better just to save my dad.
बस सोनू बस
We were up whole night, whole days for last 3 months.
For
From the moment
2 months, one person stayed awake at night with him. All night. I was in Fortis. I stayed up all night. I did
3
not
महीने
even
से
blink.
यूएसए में है. यहाँ का दिन होता है, वहाँ की रात होती है. वहाँ की रात के 2 बजे, यहाँ दोपहर होती है.
we are
2 बजे
coordinating
तक
with
ये बात करी
doctors.
होती
We
है.
are,
कभी
we are,
किसी
we
से-
are, we are doing everything possible.
3
All we
महीने
did
से.
was trust a wrong doctor, and that led to this. We trust a wrong institution. I'm being asked to sign for ventilator. I'm being asked, sure, do you think it should be put on ventilator? I'm like,
That
what the
was
hell?
insane. Why will you ask a family member to sign off on ventilator when somebody is coming in an emergency?
I'm like, yes, of course, I want to save dad. I'm told that, in the overnight he would be better. I'm like, okay. And then I'm counting on it that overnight he would be better, But then she comes and she's like, oh, you have to take him to over there. There you will have cardiologist, there you will have a oncologist, and they can coordinate better. And a part of me understands that. But I'm like, why not cardiologist here? And she's like, oh, we don't have a cardiologist. And or whatever words she used. But she literally said she didn't call a cardiologist. We are in emergency. And I didn't know his heart rate is dropping. I didn't know. We were literally told after we had left and we were near to Ambala and that, hey, we are not able to revive him.
और वो उनको एम्बुलेंस में डालते ही हार्ट रेट 50 था.
And then they told that, oh.
उन्हें बताया नहीं, तुम्हें बताया नहीं डॉक्टर ने. That is what your doctor said in the ambulance. कि आपको बताया नहीं ओरिजिनल डॉक्टर ने हॉस्पिटल में कि उनका हार्ट रेट ड्रॉप हो गया 50 पर.
If he would have told me here that उनका heart rate drop हो रहा है तो I would have taken the decision that bring him back. Let's not move right now. I will arrange a cardio doctor. I would have called Fortis and brought a damn doctor over here. I would have done anything. I took 3 months vacation just to come here and treat him. And within a week he died. I was counting on these 3 months that, he will be better. We will do main chemos. Everything will be done.
We even got him immunotherapy drug. He was supposed to get immunotherapy drug
On
this
Tuesday.
With next
On
chemo.
20th. Everything was done. Literally everything was done. I'm being told that I am telling Dr. Meera that, hey, I want to talk to my dad. Please save him. And she did this. Last moment dad was saying, please remove the tube so that I can talk. And I was like, no dad, it is needed. My dad trusted me. My dad trusted us. Whatever we said, he agreed. After the last moment, he was counting on us that yes, we will take the right decision. He responded to every damn drug. He was getting better. He responded to chemo. His liver was responding. Everything was going for good. And ask anyone in my family, ask any of my friends. I was like, I'm 100% sure my dad will live.
He would have absolutely survived cancer. He would have.
और ये एक मिरेकल होता जो ये वो लोग कहते हैं ना कि भी ओ इतनी एज होगी अब तो क्या इलाज होगा. एक साइंस के लिए, मेडिकल के लिए भी एक ये थी कि भी हाँ इस उम्र के लोग भी ठीक हो सकते हैं कैंसर से। सिर्फ उनके अंदर इम्यूनिटी होनी चाहिए, उनकी विल पावर होनी चाहिए और पेरेंट्स का प्यार और सपोर्ट होनी चाहिए।
Worst part is he didn't die of cancer. If he would have died of cancer, I would have accepted.
सबसे बड़ी बात
If he would have died of some disease, normal disease, I would have accepted. But negligence of doctors, that they transferred him to the ambulance when his heart rate was dropping. And then they're counting on me
You know, there
to
was
take a decision to turn back the car, to turn back that ambulance. How am I supposed to take that decision when I'm not even informed?
You know, there was going to be a Netflix documentary on him, that how he fought cancer. Because Department of Defense, United States of America, their chief medical officer was overseeing his treatment. She was overseeing his treatment. And there were 4 doctors in India, the top 4 oncologists who were treating him. And your team killed him. Like कीड़े मकोड़ों के ये जो doctors हैं, they killed him. When all the top-notch doctors of the world were lined up and they're all in shock. They're in shock. It's like, okay, what happened? So when we do that lawsuit, it's not going to be just a little family doing a lawsuit. There will be a Netflix documentary, there will be Department of Defense, there will be probably Fortis supporting us, there will be every damn person, and we will make sure that this fucking Cygnus location pays for that.
Means now they're blaming me that I didn't take a decision when I was not even informed.
You can't go by what those idiots are saying, Sono.
छोड़, उनका क्या है, वो तो अपनी
I wish
negligence
I
को
could
दूसरों
have
पे
done
डालेंगे।
something. I wish I could have done something.
This is not the real thing.
अपनी
Real
नहीं
thing-
है, वो अपनी नेग्लिजेंसी को, अपनी
They have to cover their
incapability
ass.
को छुपा रहे हैं, वो अपनी
See,
इनकैपेबिलिटी
मैं
को
आपको
छुपा रहे
एक
हैं।
चीज़ बोलता हूँ, इसमें आप लोगों की कोई भी गलती नहीं है, बिल्कुल भी गलती नहीं है।
You couldn't have done
आप-
anything wrong. You
आपने
couldn't have done anything different.
ये सारी हॉस्पिटल वालों की गलती है।
On the third day, the only reason I didn't take him to Fortis on the same day, because the roads were closed. And I thought 5-hour journey would be too much on that. Because otherwise it's 2 hours, otherwise it would be 5 hours. They said on Monday the roads would open, and I was counting on Monday. They said on Saturday, on Sunday they are opening the roads, on the Sunday evening they are opening the roads, so Monday the routes would be clear. That's what I was counting on, but we didn't get on Monday. If she would have kept even in Cygnus overnight that day, then maybe on Monday we could have a better option. At least we could think something. I'm being asked to sign the documents. I'm being asked that hey, give a consent to put him on intubator. I'm like, okay, yeah, fine. I want that to live. And I'm literally machine working that moment without even understanding
Forget
anything.
you. There's nothing.
No, don't take it on.
It's not on you
yourself.
at all. It's not. They put him in an ambulance when his heart rate was dropping.
Yeah, and then they didn't even inform us. If they would have told, then I would have said, no, let's go back. And if they would have informed us, then maybe we could do something. And then they're saying, oh, on 50 also we transfer. On 50 you transfer when the heart rate is from 50 to 50. You don't transfer when the heart rate has dropped from 110 to 50. His BP was fine, perfect. His BP was perfect. His numbers were looking good. His SpO2 was 98, 99, 100, literally.
And just so you know, he was a lawyer, and on his cremation, even though WhatsApp was down, there were at least 1,000 people. There are at least 1,000 lawyers who are learning about him, and they're like, oh my God, what happened? He was fine. They are going to support him. They are going to make sure that this does not happen, and they are going to make sure that Cygnus pays for it.
It is so heartbreaking. He needed a fair fight with cancer. He need not to die like this. And the worst part is we were looking for first aid. I was reading like every damn thing, trying to learn everything. The only thing I didn't learn is about heart, because I thought his heart is the perfect thing. There was never a problem in his heart. Never,
Was
ever.
Before chemo, they do ECG, EKG, normal, perfect.
On 14, 15, they did ECG, KG. It was normal, perfect.
There were mistakes after mistakes after mistakes after mistakes that were made here.
आप लोगों की तो मिस्टेक्स होगी, लेकिन भरना तो हम लोगों को पड़ेगा ना।
ये
और जिसकी भरपाई कभी है ही नहीं।
रिलेटिव्स अपने पेशेंट को
जिसकी
किसी
भरपाई नहीं
डॉक्टर्स
है।
किसी हॉस्पिटल के हाथ में सौंपते हैं तो
विश्वास के ऊपर उन्हें भगवान का दर्जा दिया जाता है डॉक्टर्स को। भगवान खुद उतर के नहीं आता, डॉक्टर्स के रूप में आता है भगवान।
And we kept telling dad, ये सब भगवान के दूत हैं, ये सब भगवान के दूत हैं। भगवान कहाँ कहाँ जाएगा, किस किस को बचाएगा, वो डॉक्टर्स को भेजता है, वो नर्सिस को भेजता है।
Dad was counting on us from the day one. He said, yes, my daughters will save me. We didn't care about anything on top of it, whether it's my job, whether it's money, whether it's anything. We had everything. We have everything. We got the best doctors to treat him. We got the best medication. But after that, just a stupid mistake, and we are here. And if it won't be political issues, then I would have taken him to Fortis. Just I wasn't sure if it would be fine to keep him in a car for 5 hours. If that day she would have mentioned that, oh, why don't you take him to Fortis instead of admitting him, then maybe we would have done that. If she would have mentioned that, why don't you take him?
4-wheelers perfectly चलाया करते थे।
If she would have mentioned that you can take him in an ambulance, we would have taken him.
Bloody, we would have hired a helicopter ambulance if needed.
Yeah. We would have done literally anything to save him. He was our lifeline. Anyhow, you have any questions or anything to discuss anymore? If you want, I can send you the blood reports and all the reports.
Doesn't matter. Forget it. So we will be filing a lawsuit.
On my behalf, in my presence, I am really very, very sorry from the bottom of my heart. If you can forgive me, the mistake my team had made, please. See, मतलब मैं कोई वैसी मेडिकल हेल्प तो नहीं कर पाऊँगा और कर पाता, बट एक मैनेजमेंट जो प्रोवाइड करने का मैंने बोला था कि आई विल गिव द बेस्ट पॉसिबल, वो बट दिस इज़ द बेस्ट पॉसिबल फॉर मी. I don't know these people what they did. This is not my field. बस मैं एक ही वर्ड है मेरे पास, आई एम रियली सॉरी. आई एम रियली सॉरी. मतलब मैं चाह कर भी कुछ नहीं चेंज कर सकता था, ना कर सकूँगा. At that time, it was the decision of the treating doctor. We have to मैनेजमेंट हैव टू बिलीव द डॉक्टर, सर्जिकल डॉक्टर अपने पेशेंट्स का, उनको ही आइडिया है ज़्यादा. मेरे पेशेंट्स का आई विल टेक होल रिस्पॉन्सिबिलिटी फॉर माई पेशेंट, व्हाट हैपन, व्हाई इट इज़ हैपनिंग, एवरीथिंग.
Let's go.